Welcome to the Discover Health podcast, where we explore the power of gut health, nutrition, and lifestyle to help you feel your best every day. I'm Dr. Josh Sharp, your guide on this journey to better digestion, more energy, and overall well-being. Each week, we'll dive into expert insights, practical tips, and real-life strategies to help you discover health. Ready to start discovering? Let's hit the trail. Welcome back to Discover Health Podcast. I'm your host, Dr. Josh Sharp, and with me today is a very special guest, my new friend, Dr. Gary Hochstetler. He's a biological dentist in Horton, Kansas, and he studied at the University of Creighton back in the 80s. And so he has just a lifetime of experience, and he's a wealth of knowledge as it pertains to not only dental health, but also holistic health. I've enjoyed getting to know him and also finding out that we have some common ground in terms of things that we've studied in the past. So I think you'll really enjoy this time getting to know Dr. Gary. So first of all, thank you so much for being willing to join me on this podcast and join me for this video. I really appreciate it. And first question is, I think our audience is kind of familiar with dentistry to a degree, but what is like a biological dentist? What is a biological dentist?
Well, what kind of separates a biological dentist from regular dentistry is we're very concerned about how what we're doing affects your overall health. And that meaning, what are we using that your body is going to be happy with? Are there toxic elements in dentistry that we might need to address? That type of thing. For instance, dentistry is kind of unique in as far as in the medical world, in that any physician is going to give you like an antibiotic or something, there's a recognition or realization that you could be allergic to something. And so if you're allergic to penicillin, you'll get something else. Well, dentistry, all of our materials, as long as it's passed by the FDA, which is they all are, they're assumed that nobody's going to react to them, which is patently false, but that's the assumption. And the sad thing is most people aren't going to break out in hives or something. Instead, if they use a filling material that's wrong for you, if you're lucky, it'll just show up as, oh, this tooth has been hurting ever since I've had this filling. And maybe things didn't feel quite right or whatever. And so if you changed out the filling and use a different material, that all goes away. However, if you're unlucky and your tooth isn't reacting, but you're starting to have body issues, you could have, and you would never associate it with the filling. 2 weeks later, I'm just having these horrendous headaches that just don't ever seem to go away. And no matter what I do, I can't get rid of them. Or I've got this ache in my shoulder or hip or knee that just showed up, and there's nothing that I've been to the chiropractor, I've been to everybody, I can't seem to get it fixed. Or even like a gut issue. All of a sudden now you've got digestive issues or diarrhea or something like that. So anyway, that's one example. The other is we're also looking at things that people know are toxic, like mercury and like your silver fillings, or got a problem with a neurotoxin called fluoride or something like that. So that's what kind of separates us apart, is we're in that kind of a functional medicine realm of how is this affecting everything else, and what are we doing that we can keep the body in line. So that's kind of the difference between what biological dentistry and traditional dentistry is. And then holistic dentistry is on a completely different realm than that.
So take me back to early years. You're going through dental school. How did you get interested in biological or holistic dentistry? Obviously, the road that you're on now is completely different than probably what you were learning while you were in dental school.
Very much so. Yeah. It really kind of starts back. I was a chemistry math major in college, and whenever we were in the lab working with particularly elemental mercury, but even mercury compounds, we were supposed to always work under the fume hoods or ventilation hoods, so and whatnot. And if we spilled anything on the floor, we had to clear out the lab, put on hazmat suits, and go in and clean up the mess in hazmat suits. Well, and they basically, our chemistry professors, who I respected a great deal, basically told me, or were telling us that mercury is really neurotoxic. You don't want to be messing with it. Stay away from it. I get to dental school, freshman setting in my lab, and they're having us breaking open elemental mercury at our bench with no protections, no anything, mixing it with this silver tin copper alloy that had been ground up into a fine powder, and that's what you're mixing it with to get the chemical reaction for the filling material. I immediately go up and talk to my dental instructor saying, we're using elemental mercury. This stuff, and in lab, they had us using it in a fume hood. What's the deal here? Oh, it's no problem. You're not going to have any problem at all. We've been using this for 100 years. It's not a big deal. When you mix it with this, you get a chemical reaction. It sets up, and there's no elemental mercury in there. And it's like, huh, okay, well, I wasn't buying it. And all the way through dental school, I was always kind of in an argument with my instructors, asking how mercury, and plus then it was starting to come out. I graduated in 1984, and it was starting to come out, and with my first or second year in the studies, they were starting to say, well, they didn't have instruments that could read this before, but they were starting to develop more fine-tuned instruments, and they're saying, well, there's this mercury vapor coming off of the fillings. And they're saying, well, it's negligible. It's not any, I mean, you're going to get more mercury from eating a can of salmon than you are from any of your fillings or anything. Well, but no one could really were explaining very well, where does this mercury coming from? Because if it's a chemical reaction and it's bound together, it shouldn't be coming apart, right? Well, got to thinking about it like many years later, thinking, and this is in our dental material textbooks. If you get the exact amount of mercury to the exact amount of powder, and for a perfect chemical reaction, you're left with these clumps that you can't do anything with. So you add a little extra mercury in there to wet it to make sure that it's pliable and you can move it around and whatnot. And so that's literally my analogy to explaining this to people is, I've got a bucket full of sand. I can't get anything in there. It's full, but I can bring in a half a bucket of water and pour it into the sand, and it goes in there just fine. No problem. Well, it's going in between all the spaces, and that's what elemental mercury does. So it's a liquid at body and room temperature. So it's going in between all these spaces, and it gets trapped in there.
Mm. Yeah, it's very
Because
interesting.
when we put that into a tooth, you're pushing on it real hard, trying to squeeze the excess mercury out. Well, you can't get it all squeezed out. It just doesn't work that way. But anyway, going from there, after graduating from dental school, I had wanted to go to Colorado. And so had gone out to Colorado, and a practice that I had joined, there was a dentist there, which much to my great surprise was removing the silver mercury fillings for health reasons, and because mercury was bad and it was leaking mercury. And it's like, well, my dental school wasn't teaching this. What's going on? Well, just so happened that in the late 60s and 70s, there was a dentist by the name of Hal Huggins in Colorado Springs that was bringing this issue of mercury in fillings forward and making it kind of well-known type of thing. And then by the 80s, he had treated thousands of people with mercury fillings, taking them out and replacing them. And a lot of people that had different medical issues and whatnot had totally reversed and were getting a lot better and whatnot. And anyway, this dentist, when he was doing that, I was very intrigued with that. And so that's what made me kind of want to join that practice there. And then there was a dentist about a half a mile up the road from us that had this name, or it just that said on the building, holistic dentist. I'd never heard of anything like that. I didn't know what that was. It didn't make any sense to me. I don't know what a holistic dentist is. And to top it off, he was sharing office space with a chiropractor, and that was unheard of back in the day too. It was just, wow, this is really bizarre. So just so happened, it's kind of interesting when the student's ready, the teacher appears type of thing.
Yeah.
Just so happened after I noticed this a few weeks later, I had this patient coming down the hall with me. He was had a very ataxic gait, meaning he was kind of wobbly and walking. I thought he had Parkinson's is what I thought. It's just kind of this neurological thing. And when he sat down in the chair, he reaches in his mouth and pulls out this orthotic appliance. It's a splint is what we call them. They're used, well, they look like a mouth guard, athletic mouth guard, or a bruxing guard that you would wear at night to protect your teeth, whatever. He pulls it out of his mouth and told me that I really need to have this in my visual range all the time. I cannot afford to lose this. And I just thought he had a real bad temporomandibular joint problem. And so I asked him, and I said that, so you have really a bad TMJ problem? And he looks at me, he goes, well, since I don't know what TMJ is, I'm going to have to say no. And I said, okay, well, what do you have this for? And he said, well, I have MS. And if this is out of my mouth for more than 2 hours, I cannot walk. I cannot feed myself. I cannot do anything. I said, okay. And then he said, well, just watch. He was going to be there for about an hour. You just watch how my body responds by the end of the time we're here. And I said, okay. So anyway, I said, who made this for you? I thought some physician had made it. He goes, oh, a dentist up the street, holistic dentist. And so, okay. So what brought this on? I said, well, I'm in an MS group, and we have meetings all the time. And they had mentioned in there that there was this dentist that could help about 30% of the people that had MS. And so I went to go see him, and he did some testing on me and said he thought he could help me. And so he made some molds in my mouth, had me come back a few days later. We put that in my mouth, and he said he wanted to see me in 3 days. He said, I left the dental office in a wheelchair, and 3 days later, I walked back in.
Hey, friend, real quick. If you've been enjoying this episode and you're looking for high quality, professional grade supplements that you can trust, I've got something for you. Check out our curated online store at discoverhealth.gethealthy.store. We've handpicked practitioner grade supplements that can be delivered straight to your door. And to say thank you for listening, you can use the code FIRST10 to get 10% off your order. That's discoverhealth.gethealthy.store. Your health simplified.
And I'm
Wow.
going, okay, I don't understand this one at all. So I, in turn, thought, I'm going to go see this guy because I've never heard of anything like this. And so I went and walked into the office, and it was an office like I'd never seen a dental office with all of these vitamins, and I didn't know what all this stuff was. Turns out there were homeopathic medicines, vitamins, different, all kinds of herbal remedies stuff in there. I had no idea what I'd walked into. But anyway, I set up a time to meet this guy, and then he started explaining to me about muscle testing, AK, how body neural system is affected by how your joints and everything are either over, what do you want to say, over condensing or whatever. So anyway, That was my introduction to a holistic dentistry, and he was doing like things like cranial sacral therapy and um, man, you name it. He just opened a door for me to start going down, and that's where I got my interest in it because I'd never heard of this stuff before. So when I saw what he was doing for people, he was head and shoulders above what any dentist I'd ever seen do anything for anybody. So that was,
Yeah, that's an amazing sight. Whenever you see someone that has kind of transcended their profession, they've integrated, learnings from other, other disciplines even, and to see how they're helping people, sometimes is transformative. It really can change your course, so to speak. And
oh, it, the neat thing is that the chiropractor and himself, one of the things that he kind of ingrained in me, but it had found out later to be true too, is when people have temporomandibular joint dysfunctions, they've always got a cranial dysfunction. And if you get the
Mhm.
cranial function back right, then that can get a lot of help with the joints, TMJ joints. But if you've been out of balance for a while, when you when you're biting together or had ground your teeth into a certain position, when everything gets straightened out, now your teeth aren't hitting quite right anymore. And so you have to make some minor adjustments to allow the bite to reestablish so things don't come back out, because there's a lot of problems with chiropractic adjustments. They just seem to keep going out every week, every 2 weeks, whatever. And a lot of times it's because they've worn a pattern in their teeth so that as soon as they leave your office, their musculature chewing and grinding back in causes everything to relapse and go back. So what they would do is they were sending people back and forth all the time. He'd send people over to the chiropractor to get an adjustment so they could come back and he could make a bite adjustment. I mean, it was just back and forth all the time. And so it was kind of, well, that would be great. I'd love to have one of that set up. But anyway, never happened.
Yeah,
So,
I think you're kind of alluding to my next question right now. And the next question is, why is it important to look at the mouth from a whole body perspective? So you just pointed out the biomechanical aspect, like how your bite actually comes together, how your teeth make contact can affect all different types of biomechanics. So basically, how your body is able to coordinate and move. What are
right.
some other areas that the mouth affects or our teeth affect the whole body?
Well, for instance, and this is kind of chicken and egg problem here, what came first. But for instance, we can pick on a thing like, say, you're um, 12 months old or 2 years old or whatever. You've got strep throat. They give you antibiotics for it. Um, Unfortunately, the antibiotics wipe out your gut flora. And let's say that in order to rebuild that, ideally, these days we would give you some probiotics and stuff to kind of get things regenerated or whatever. But if nobody did that, you're left to trying to get things repopulated by the bacteria that's in our food and and whatnot. And if you're not getting that, if mom and dad are raising you on a diet of Happy Meals, macaroni and cheese, Diet Dr. Pepper, and Ho-Hos, you're not going to be getting any of the proper bacteria built back in. So now you're going to have a gut dysbiosis. And that directly affects what's happening because the same thing is happening in your mouth. You have a certain normal flora that lives in there that, under normal circumstances, if it is a normal type of flora, it is keeping there are certain types of bacteria that are very karyogenic, meaning they're the ones that produce decay, literally, which is the bacteria live in a sticky substance called plaque that's on your teeth that when you have a certain amount of well, if you have simple sugars or whatever, that's what the bacteria love, or simple sugars. They metabolize the sugar, and then their byproduct, or as my hygienist, an old hygienist I had used to like to say, these bacteria poop acid on your teeth. That's the byproduct of the sugar. That literally starts to dissolve your tooth, which you're starting to get a hole or the decalcification of the tooth structure, which eventually turns into a cavity and eats a hole in your tooth type thing. So anyway, that if you had all the proper bacteria and whatnot, could help dispel that type of a thing, because the good bacteria try to pretty much kind of push out or aside the bad bacteria. But if they take a hold, then they're pushing out the good bacteria. And so you've got all these bad bacteria in there that are affecting that. But when I was looking at talking specifically about the diet, that in and of itself is a problem on its own, even if you didn't do the antibiotics, because you're affecting the gut biome and the oral biome, meaning the colonies of bacteria that you've got in both places, from going from good to bad. So now you've got, and so who's affecting who? Well, they're affecting each other. It's a vicious cycle going on all the time.
So we've got a connection with biomechanics. So basically, how our teeth connect, affecting the way our jaw aligns, affecting all kinds of bioelectricity that can happen with those teeth touching. We also have the flora, the microbiome in the mouth, and how it affects the gut and the esophagus and so many other things. But are there other ways that dental health issues can impact the body? Are there other mechanisms that can
Yes,
occur?
there are. Then you got to look at the electromagnetic spectrum. And if you're attuned to like acupuncture, or have heard of acupuncture or whatever, you'll realize that there are some certain main meridians that are flowing, which is literally the body's electrical, kind of a outside electrical thing. It's not a true nerve, but it's a line of magnetic electrical energy or force that comes out. Well, oddly enough, each tooth has its own, well, each tooth, or maybe one or two teeth, are connected to certain meridians that are going on. So if you're having a problem, like say you have a colon issue, that a lot of times, because there's a disruption in that meridian, can very easily affect the lower molar on your in your mouth, meaning that it can set it up to be uh, to decay easier, it weakens it literally, so that it's easier for it to break. Can't explain how or why that happens, but you tend to see that type of thing. And vice versa can be true also. Like say if you got an amalgam filling in that lower tooth, that's disrupting the meridian down to the colon and makes it a lot more receptive to having something bad happen to it too. And then you also have to look at anytime you have an electrical current flowing, which, kind of a sidebar, if you have multiple metal fillings in your mouth, anytime you have two dissimilar metals in a moist or liquid environment, you've got a battery, and you've got current flowing. And when you've got a bunch of fillings, you've got currents flowing all over the place. Well, the bad part about a current flow is that you've got a magnetic flux around that. What that means is that when the current's flowing, it works the same way in a wire. If you remember your old science fair projects where you had a coil of wire hooked up to a light bulb and you moved the magnet over it, it generated electricity to flow and light up the light bulb. Well, the reverse is that anytime you have current flowing, you've got a magnetic field around here. Well, if you've ever taken a north-south magnet, two of them, and tried to put two norths together, you get a repulsion. or you get a south one and now it's an attraction. Well, you've got all of these magnetic fields going. Some of them are being bound to one another, others are being pushed apart, and it literally disrupts the whole uh, ecosystem as far as the meridians and everything are going because they're all affected by how all of these magnetic fields are interacting with all the meridians and everything. So what that means
Absolutely.
for me or you as from a dental perspective, what would happen typically everything would be functioning normally when you got this hot mess going on up here, it's disrupted all kinds of things and your body's having to try to reconfigure all the time on how how it's dealing with all of this stuff. So stuff we don't ever think about, but that's the
Absolutely.
important part of, once again, of biologic and holistic dentistry, as we're really trying to keep the lines of communication of the body and brain and everything all aligned and flowing like they're supposed to.
Absolutely. In practice, I noticed that phenomenon also. You might have a patient that there's no obvious reason why they shouldn't be improving. There seemed to be something that was holding them back or preventing results from occurring. You've done everything else you can think of. Then the next step for me was often to recheck the mouth. And so I used a technique with magnets, and sometimes we might find a tooth that had, some type of trauma to it or something, or we might do a little cranial work or something. But I was never more amazed than when treating a tooth and then seeing an amazing change, a range of motion, or seeing, somebody's years long or decades long symptom dramatically change just by, doing something with a tooth or a cranial suture or something like that. And so that really speaks, I think, to that magnetic field that you're talking about and how important it is that those things are able to do what God designed them to do, and not be interrupted by all these competing signals.
Very
So
definitely. And then there's one other aspect that kind of goes into this is when you're looking at energy fields and whatnot. One thing that I think it's getting to be a little bit more seen these days by a number of at least chiropractors and whatnot, and functional medicine folks, that um, you can literally be affected by things that have been inherited and we tend to think of just genetic things, but you can also have passed down to you trapped, we call it trapped emotions, but it's literally you get these trapped energy fields that you would like to think that that's stuck with mom and dad, but no, it got passed on down to you, and you can be experiencing some traumatic issues in the body that great grandpa had or whatever that are starting to be expressed and they show up under the right conditions. So anyway, that's just what brought that to me is that I had just probably just a couple of weeks ago had worked with a patient that and I forget what she was having issues with, but I had kind of traced it down to some trapped energy in a tooth, which I had released. And then I see her like a couple of weeks later, and she's telling me how all of her uh, uh, those colon issues had just seemed to disappear. And it's like, colon, you didn't say anything about that. And she said, well, I didn't think it was relevant to what you were doing. Well, it probably wasn't at the time, but it's just one of these things. Oh, that was magic. Okay, cool. I'll take it. But
I love those happy accidents.
yeah, exactly.
Okay, I guess, okay, I wasn't going for that, but praise the Lord.
Yes,
So,
indeed.
what are some early signs that someone might see that their oral health could be affecting their overall health? Is there something people could be looking for in terms of maybe their issues could be stemming from an oral health issue, or maybe there's a sign that there's a connection?
Um, that's a tough one because I can look in somebody's mouth and recognize that we've got some systemic issues that we're dealing with. And typically, like if you are having, well, I can guarantee you, if you're having problems with um, bleeding gums and heavy plaque content all the time. How many times do I hear people, I brush my teeth 3 times a day, and you look in their mouth and you question whether they're what end of the toothbrush they're using because it doesn't look like it was doing anything. But what can have an effect on there is, um, well, let me backpedal a second. It's when people want to know why they're getting decay. My simple answer is, well, you're having basically a calcium metabolism problem. Okay, well, how do I fix that? Well, now then, when you have the headline of calcium metabolism problem, now you have about 100 different pathways that you could be going down because
Yeah.
there's any number of these that can be disrupted and any number of, or multiple of them that can be having problems. For instance, if the hypothalamus isn't functioning right, it can't tell the pituitary what to do, which in turn can't tell what the parathyroids are doing. So that's what's determining calcium dispersion and whatnot, or stomach acids. Do you have a strong enough stomach acid? Because you have to have a lower pH and able to absorb the calcium. But then also you need to have magnesium present, and you also need to have vitamin D in adequate levels. And are you absorbing the vitamin D? And I mean, it can cascade to all kinds of places. So, um, having said that, when I see something, or you can look in your own mouth and see that you've got like a heavy plaque buildup, or you're developing cavities, or your gums are bleeding real easy, which can also be a classic sign of scurvy, for instance, not getting enough vitamin C type of thing. Um, it you can start seeing where there could be other problems, and can you relate that to a specific thing? Typically, only, for instance, like if you had uh, some different pathological issues where they do have certain aspects of, like ulcerations in the mouth or something, that you could pinpoint. But even then, for most people, it's, well, I've got something wrong here. Is there something else going on? Because that would be one of the first things, at least in my mind, I would be looking at. Well, where am I having a breakdown here? Why is it showing up in here? So.
Okay. Is there any chart or diagram if somebody knows they've got a cold sensitive tooth or a hot sensitive tooth, or maybe they know they've had an issue with the tooth before? Is there anywhere people could get some information on what areas of the body or what things that could be affecting outside of just their oral area, outside of just their mouth?
Yeah, you can actually Google a tooth meridian chart, which there's a bunch of them out there. And I also have one on my homepage on my website where you can, down at the bottom of the page, there's a little diagram down there that you can click on a tooth and it'll show you all the relationships between organs and vertebrae, and I mean, a whole number of things. So there's that type of information available.
Yeah, and I think that can be a great help if you're someone that's a chiropractic patient and you notice like, oh, I'm always having trouble in this particular area, or the chiropractor is always treating this particular area. It might be a good idea to check out your website and look at that chart and see if maybe there's a relationship between one of those teeth and that area, or the same with if you know you have an issue with your stomach or something. Sometimes it's a good idea to go ahead and just be your own advocate and look at a chart like that and see if
Oh, exactly.
maybe I do need to see a holistic dentist or someone that could help me figure out if there's a connection, and get those things taken care of. Speaking of those connections, um, obviously you mentioned mercury and amalgam. Are there any other dental practices that may have been done traditionally that you have changed your mind on, or anything that you are doing differently than what a traditional dentist would do, in terms of
Well,
what was typical?
these days we tend to try to, holistic and biological dentists try to go as metal free as possible. And that has a lot to do with those magnetic fields that I was talking, battery type of thing. But like traditional crowns, for instance, that we used to make, well, many years ago, they were gold, which for most people aren't a problem, other than you still can have the electrical flows or whatever, but they're usually not any kind of a problem with people reacting to gold. There are a few people that are allergic to gold, believe it or not, but that's kind of rare. But back in the, I was right when I was in dental school back in the 80s, gold prices shot up. And they were making, and had been started making caps or crowns out of gold with porcelain fused to the top of it, so it looked like your color of your natural teeth and whatnot. Well, when gold shot up, they were looking for cheaper metals, and so they went to some metals that were called non-precious. Well, the non-precious alloys were made with nickel, beryllium, chromium, um, all kinds of things that cause a lot of allergic reactions in people. Actually, and nickel. Everybody's allergic to nickel to some degree. Everybody's allergic to beryllium. Everybody's anyway, they were making crowns out of these things, and I could look in somebody's mouth and tell you by looking at the gum tissue around it, because it's always red and bleeding and whatnot because
Mm.
of these metals that were in there. So we don't like to use them. Most dentists, I think, but they still, oddly enough, there's still and dentists that are still making these porcelain fused to metal crowns out of these cheap non-precious metals. Most people that I'm aware of are usually, if they're going that route, are using like a semi-precious or precious metals that are made in the as a base metal with stuff that people aren't going to react to. So, but that's one thing
Okay.
that's changed a lot. And I'm going to say that not even necessarily all of the just holistic or biological dentists are kind of trying to move away from the metal. They're going to more like zirconia, some type of ceramic materials. Instead of the metals, which is a good transition. But for those that just regular dentists, it's not because it's a healthier thing. It's just that's the direction their market's going. So anyway.
I see. If somebody had an amalgam, like if they see that they have one of those dark colored or gray fillings in their mouth, or if somebody knows that they happen to have one of those nickel or beryllium, those non-precious metal crowns, what would you recommend that they do?
Well, if it were me, I want those things out because they're those very metals are neurotoxic and have, well, other issues too. For instance, with the non-precious metals, they ended up taking beryllium out of it because what they found was all these lab techs that were grinding it and breathing it, high majority had developed lung cancer.
Oh my gosh.
And so it became rather obvious maybe we shouldn't be using this. But at any rate, the with amalgams, um, I would advise people to go to YouTube and look up smoking tooth. What you will
Smoking
find,
tooth. Okay.
smoking tooth, what you will find is a video of a tooth that's has an amalgam in it. They had extracted the tooth, and this amalgam had been in there for 20 years. And what they're doing is holding it up to a phosphorescent background. And basically what that means is that now you can see anyway, this vapor is coming out. And it literally looks like some smoke that's coming out of the tooth. And what it is mercury vapor. And what they do is they'll take the eraser on a pencil and rub it. Now all of a sudden that mercury is really coming out. Anytime you increase energy into that filling, it releases a lot more vapor. So you can imagine what's happening when you're chewing, brushing your teeth, whatever. It's really releasing a lot of the mercury. And kind of as a side note is that as that filling gets older and older and the mercury is eventually coming out, all of those spaces and that where the mercury in between those um, metal particles that I talked about earlier, now they're starting to become vacant and hollow in there. Now that's causing the filling to weaken. So now it starts to break apart and crumble. And so now you just take that out, put a new one in, start the whole process all over again. But anyway, with the smoking tooth, I can't remember if there's another video that they made one. I don't know whether they actually put it up on YouTube or not, but they show what it looks like when you put a handpiece onto it. Instead of a smoking thing, as soon as they touch that with the handpiece, the whole screen just goes blank because it's like an atomic bomb went off. There's so much mercury coming out of there. So,
What's a handpiece? What do you mean by
oh,
handpiece?
the dental drill.
Oh,
When you're going with a little burr or bit, if you want to call it, when you're trying to touch it and to remove the old filling, as soon as that touches
oh,
it, it just releases an explosive amount of mercury. So it's very important when you're having old fillings removed that you're doing something to protect yourself against inhaling, swallowing any of the mercury because there's a lot of mercury coming out of there. So what a biological or holistic dentist does is they're very um, adamant about protecting you and their office staff against mercury coming out of there. So they'll be removing it with a rubber dam, which is a thing that just isolates that tooth from the rest of your mouth, having vacuums and whatnot going on. Usually, as a holistic and biological dental practitioner, we're also covering ourselves up too. So, I mean, we literally look like we're setting in a biohazard unit while, while we're taking these things out. But I mean, they've been removed by general dentists just openly like that for years. It's just if you've got the ability to handle processing heavy metals and getting rid of them rapidly, um, I'm going to say you'd be okay. But problem is that most people can't do that. There is some genetic testing you can do to see what group you fall in. But most people, it's um, you ingest a heavy metal, it'll get rid of some of it, but the rest of it gets stuck someplace else. And so it's just a lifetime of building up toxins and a lifetime of trying to get rid of them. So,
yeah, absolutely. And especially, you feel for some of those dentists that might be doing that. It's one thing if you did one every couple years, but if you're doing them day after day, year after year, you have to imagine no matter how well they were detoxifying those metals in the beginning, there's just a limit, to what their body can do. And you have to imagine that's building up and causing a lot of potential
well, it's
health
very
issues.
true. In the early days, we didn't start doing this stuff with the protection for the dentist and whatnot until I'm going to say maybe in the early 2000s, something like that. Dentists actually, I've known three holistic dentists that have had to quit because of mercury poisoning, more mercury
Mm,
toxicity, because they were removing a lot of mercury and for people, and they had no protection against it. And it's
wow.
when you're removing it, it's just a clear, odorless gas that you can't see or you don't know anything about. And uh,
Mm,
there was the guy that I had joined practice, he was kind of concerned about it, and the best that they had was they made a face mask with charcoal lining, and so he used to wear those. I'm sure it helped, but didn't protect him completely against all of that. So,
yeah, sure. So, real quick, I wanted to get your take on the topic. I've heard a lot of mixed reviews, and so I'm not sure which side of the fence I'm on actually, but what's your take on root canals? And are they an issue for the body or from a biological perspective?
I'm kind of unique on that. Most holistic and biological practitioners will just say if the nerve has died and whatnot, or even if you have root canals, get them out.
Okay.
Um, I've and well, there is good reasoning in that there is a can be a bacterial uh, endotoxin load that depending upon whether how it was the tooth was treated and whatnot, some can be a lot worse than others. But there's always the concern that because it's not a live organism or organ anymore, dentistry is the only profession that tries to retain a dead organ in the body. Um, Having said that, um, if you don't have any way of actually knowing whether the tooth can be actually salvaged that way or not, that's your only avenue is to be sure that you're not going to have a adverse event. There is a methodology of doing root canals that can actually determine or tell you how the body's or how it's responding to the body and whatnot. There's a certain type of filling material that they put in there that when they do the root canal and they go back in and check it, if the pH is correct, the material sets hard, and so you know it's okay. But as soon as things start turning around, like if you're starting to get an infection, the pH changes and it turns that hard material back into a soft material again. And so you can tell if it's actually um, having a negative effect, but I don't know. There aren't very many people that do that. Most holistic practitioners say get it out. Now, where I say I'm a little bit different is that because I do a lot of muscle testing and whatnot, I am able to see if the body and the tooth are going to respond to that type of therapy. But my thing with it always is okay, if we can safely do it, fine. But you have to realize that you're literally just renting your tooth for a while because at some point in time, anything that I do is going to break down and fall apart. And if you're lucky, it'll last you for 40 years. If you're unlucky, in 3 months, it's going to start to break down. So um, that's, are you willing to risk that fact?
Yeah.
So,
Thank
um,
you.
but not very
Is
many people are in that frame of mind like myself. Plus, we also do a lot of treatment with ozone and stuff that kind of help that process. But at any rate, um,
okay. Um, Parents with children, are there any extra things or any things that parents should be aware of at an early age when it comes to dental health that you would recommend? Maybe something outside of what's typical or traditional. What should parents be doing with their children to prevent problems in the future? What are ways that they can be um, working towards avoiding some of these issues that they might come across from, tooth decay, or they might come across from some of the other dental issues that you've seen?
probably some of the biggest things that parents can do is one is to brush their children's teeth for them. I mean, this is just standard dental care. This isn't any special from holistic or biological aspect. Is they need to brush their children's teeth for them up until they're about 7 or 8 years old. Um, Kids just lack the dexterity. They can't do it. Now, one of the things that has helped over the years have been the advent of ultrasonic brushes. So if you have an electric ultrasonic, there are a lot more possible to be able to do that. But even with those, you can't you can't get in and do one of these scrubbing things that just doesn't cut the mustard with, especially with ultrasonic. It's kind of just a slow, gentle, all over the teeth, let the bristles do the work type of thing. But that can really get in there and get things cleaned up. Also, the standard thing of don't be sending them to bed with juices or milk or anything like that. And also don't give them a snack of things like raisins or candy bars or anything to that effect, and then having them go to sleep and um, your saliva flow diminishes to nothing. And when you're sleeping, just has a nice warm, wet environment. And guess what grows really well in nice, warm, wet environments? Bacteria. So um, those are very important to make sure that you're keeping teeth clean. My big thing, get kids started early on a good diet as far as my recommended thing would be, this is hard. I'm not even going to pretend that it's not, is eliminating as much as possible processed foods. And just you need to eat a healthy lifestyle. Most U.S. grains are kind of suspect just because of all of the uh, toxins and stuff that are put into these hybrids and whatnot. So that would be the next best thing. And then for children and adults, um, as a holistic dentist, where I'm not a fan of fluoride. Um, it's a neurotoxin. However, I once again differ with my holistic colleagues on that. If you are the type of kid that has, once again, your diet is ho-hos, Happy Meals, Diet Dr. Pepper, and whatnot. One more neurotoxin to help strengthen your tooth structure with fluoride is probably not going to be that big of a deal. But do I like the fluoride? No, but in some cases like that, and especially when you're talking about um, some poor kids that are just neglected and whatnot, it's
Yeah.
you got to do the best that you can do for them, and so I kind of make exception for that type of a situation. But for the most part, for the rest of us, one of the best things that have come out in the recent years is nanohydroxycalcium apatite, which hydroxyapatite are the crystals that your teeth and bone are made out of. And if the nanoparticles, if you start to have what I was talking about, decay with demineralization, it will literally rebuild your tooth structure, which is not anything that fluoride could ever do. It just kind of case hardens your tooth structure, but it can't rebuild it. Whereas the calcium hydroxyapatite literally can. So that is a good thing to switch to, are the toothpastes with that, which can be kind of hard to find because the studies actually show that you need about a 10% concentration of that.
Okay. I'm writing that down because I want to look into that myself. So if
If
someone
you
is,
go,
go ahead. I'm sorry,
just
go
a
ahead.
side note, if you go to, is it the toothpaste is called Dr. Jen's. She's not a holistic dentist, but I think she's a pedodontist, I think. But anyway, she's got a lot of like papers and stuff that you can find on hydroxycalcium apatite. And there has been a lot of research. Actually, Japan's been using this for 40, 50 years, finally making it here. But anyway,
We're always the last to get something like that.
can't explain
Uh,
that.
oh yeah. Do you have any tips for people that are looking for a biologic or holistic dentist in their area? Where could they go to find um, biologic or holistic dentists where they are?
If you go to let's see, what is it? iabdm.org.
IABDM.org.
iabdm.org. International
Okay.
Association of Biological and Medical, or International Association of Biological, yeah, Biological Dentists and Medicine. So
Okay.
anyway, But they have a search bar that you can find a biological dentist. The Holistic Dental Association, I think, is hda.org. You could Google that one, Holistic Dental Association, but they have the same thing. They have a search bar for any holistic dentist. And then there's another website, IAOMT.org. It is probably bigger than both of those, but its whole purpose was initially when it was formed was proper removal of amalgam. So
Okay.
um, that was what they've kind of been transitioning more into the biological dental realm too. So the dentists that you find on that one are all know about proper removal of amalgams. The biological and holistic people are the ones that uh, tend to know about a lot of the other stuff that I've been talking about. Because people at IAOMT.org, a lot of them are just kind of getting started into learning about the dangers of mercury and possibly fluoride and whatnot, but they're still in the journey. And not all of them, I mean, a lot of them are seasoned. Like for myself, I belong to all of them. So it's not, you're going to find people that kind of are all over the place, but those are probably the top three best places to find something.
Okay. And if somebody wanted to find you or your office, what's a good way they could do that? You're not too far from the Kansas City area, right?
And I'm about an hour and a half away.
Okay.
It's in Horton, Horton, Kansas, and my website is thenaturaldentist.net.
Okay. Well,
And
thank
why
you.
.net, I can't answer that for you other than .org or .com was taken, and I just thought that would be the next best thing 25 years ago.
Okay.
So
I will put a link to these websites that were mentioned, and I'll also try to link the YouTube video, The Smoking Tooth, that you mentioned, below this podcast and below the video. Thank you so much for taking the time to join me. I've learned a lot, and I really think that our listeners and viewers will also learn a lot from watching or listening to this video. Any final words?
just try to be as healthy as you can. It's really important to watch what we're eating because we are just loaded with toxins in our environment and our foods and everything else. And um, that's the best way to stay healthy. So
Well, great. Thank you so much.
you bet. Thank you.
Thanks for tuning in to the Discover Health podcast. Remember, your health is a journey, not a destination. Keep exploring, and we'll see you next week.